Mommy Brainers! Welcome to episode 2 of my new series, Fully Informed. Today we're going to be talking about hospital births, home births, and birth center births, and what the difference is. Are home births really sanitary? What type of equipment is found at a birth center? And are there any downsides to a hospital birth? I want to talk about all that, but before I start, I want to reiterate that I'm not sharing my biases with you. I'm only sharing factual information. I'm going to link all my research down in the description area below, and there's quite a few links down there, so if you ever feel like looking up for yourself, you can click any of those links, and my hope is that I give you the information that you need to make the choice that is best for your family on where you birth. So let's get started. So you probably know that most women in the United States do give birth in hospitals, and most people in the UK do as well. But in the United States, 99% of women give birth in the hospital. So let's talk about the pros of hospital birth. So the biggest reason people choose hospital birth is because it is set up for emergency situations. So it is set up to handle any of your emergency needs for you or your baby. They all have NICUs, operating rooms, and doctors and surgeons all on staff in case something goes wrong. Other pros are that insurance covers at least a portion of hospital birth. And, of course, there are epidurals and narcotics and a whole array of medicated pain management options available to you at a hospital. Hospitals are seen as the safest and cleanest way to give birth in our current society. So why would someone choose against a hospital? I think it's important to talk about the cons because there are some cons associated with hospital birth. The biggest con, of course, is that the C-section rate in hospitals for low-risk women, these are women who weren't likely to have a C-section to begin with, is 27%. The recommendation is to be less than 15%. So 27% of women have C-sections in a hospital. The intervention rates for hospitals are much higher, and this includes vacuum or forceps-assisted deliveries, episiotomies, inductions, and things along those lines. And another downside, of course, to interventions in general is that intervention leads to intervention, which leads to intervention, which tends to end up with such a high C-section rate. And of course, the final con of being in a hospital is that oftentimes hospital policies and your doctor preferences will get in the way of some of your desires for your birth. For instance, you might really want to birth, push your baby out using gravity to your advantage. In a hospital, you might actually be required or made to lay on your back to do so. So you definitely want to check with your doctor about those things, or your midwife, and look into what freedoms you have in your hospital. As you can see, hospital births are really good at treating high-risk pregnancies, but they seem to be falling short a bit in the low-risk pregnancy area. So what happens if you don't want to do a hospital birth? There are other options, and we're going to talk about home birth now. Women who opt for home birth tend to do that because they trust their body's ability to give birth without medical intervention, and they're looking for a more natural or traditional way of giving birth. So let's talk about the pros for a home birth. Home births are usually attended by midwives, certified midwives, and in our head, sometimes we imagine like an old lady with hers in one hand and a pair of scissors in the other, but that's just not the accurate description of a midwife nowadays. Midwives who attend home births will often bring much of the same equipment you would see in a hospital. They have emergency interventions if necessary. They just tend not to use them as frequently. Also, midwives are trained to see red flags, so they're trained to spot an emergency before an emergency is actually happening. They'll see if something is going to be going wrong, and they'll transfer you to a hospital far before it becomes an emergency situation. All in all, 88% of women who wanted to give birth at home will give birth at home. That means 88% of the time there's a success rate. Also, the cesarean rate is far, far lower than at a hospital. Only 5.2% of women who started out at home will end up having a cesarean section at a hospital. The induction rate for a home birth is only 2.1%, and other interventions that we mentioned before are also significantly lower at home compared to at a hospital. What about your baby safety? Only 2.4% of babies will end up needing a transfer to the hospital, and even less of those are urgent transfers. Home birth also increases breastfeeding outcomes. At home, of course, you don't require any transportation, so no bumpy or long car rides for you. The studies have concluded that home birth is safe or safer than hospitals for low-risk women. The question is it sanitary? And the answer is yes. Your house is surrounded by your germs and your microorganisms, all of which your child is going to be exposed to within the first week of life anyway, and all of which your breast milk is going to be safeguarding your child against. Whereas in a hospital, you're surrounded by many other people's microorganisms, many other people's germs. I mean, hospitals are the place sick people go. So while hospitals are more sterile, your home is equally as sanitary for your baby. And your midwife will, of course, help you get ready and get things clean for the birth. So let's look at the cons real quick. The most obvious one is, of course, that a NICU and OR access requires transferring to a hospital. Other cons consist of a home birth not being safer for high-risk women, and some women really do enjoy the 2 to 4 day period at a hospital where you're not going home and you're surrounded by nurses and doctors, which you don't have at home. And many insurances also won't cover home birth, but it's always good to check with your insurance company to make sure. A home birth is really perfect for low-risk women who want a natural birth and don't want to be in a hospital setting. But what happens if you don't want to be in a hospital setting, but you're also not comfortable with the idea of a home birth? Well, there's an in-between, and the in-between is called a birth center. So let's look at the pros of a birth center. Birth centers are run by the same people home births are run by, midwives, and midwives who are once again trained to spot emergencies before they happen. An additional pro to having a birthing center birth is that where it would be difficult for a midwife to transfer all her equipment to your home, she can have a lot of the same emergency equipment, even more of the same emergency equipment that hospitals have at the birthing center. So there is a higher degree of safety there. 4% of women who wanted to give birth at the birthing center will go on to do that. Only 2% of the women who do transfer require an urgent or emergency transfer, which is really good. The C-section rate for birth centers is only 6%, and once again, 6% for birthing centers, 5.2% for home births, and 27% for hospitals. Only 3% of babies will need a transfer from a birth center to a hospital, and at a birth center, your birth plan is going to be more respected. Many of the interventions or routine procedures that they do at hospitals, they do not do at birthing centers, so you'll have the ability to eat and drink during labor, and wear your own clothes, use gravity to your advantage. Anything on your birth plan pretty much can happen at a birth center. Birth centers also only cost about 1/3 of what a hospital birth costs, which is a pretty big difference. So you should definitely check with your insurance. The biggest con is that, once again, access to a NICU or an OR does require a transfer. And a potential con for some people, but also for other people might be a pro, is that at a birthing center, you are typically only there for about 12 hours to 24 hours after giving birth. So you're discharged much sooner than you would be at a hospital. Once again, for some people, that's a huge pro. For other people, that's more of a con. So that's something to take into account when you're considering a birth center birth. So there you are, the research on hospitals, home births, and birth centers. What type of birth are you planning, or what type of birth have you had? Do you have any questions or comments? Please leave them below, along with any suggestions on what you want to see in more fully informed episodes. Next time we're going to be talking about ultrasounds, so stay tuned for that. Like, subscribe, and I'll see you next time. Bye.